Hey there, mom and dad, do you have a newborn? Well, you should know how to recognize an umbilical cord infection. Do you note a red lump of tissue on your baby's belly button after the cord has fallen off? Or you note a bit of bleeding? Or you notice a yellowish discharge from the umbilical cord area? In this video, we will talk about how to identify an umbilical cord infection, when to worry and see the doctor, how is umbilical cord infection treated, and how to take care of your baby's umbilical cord at home. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Umbilical cord infection. Is it an infection? Well, for the umbilical cord, it is but normal for the clamp cord to develop a scab at the end. It is also normal if there is a little bit of bleeding, especially around the base of the cord. But bleeding should be light and quickly stop once the pressure is applied to the area. These are the signs of an umbilical cord infection. If you note red, swollen, warm, tender skin around the base of the cord, if you notice pus, yellowish, greenish fluid oozing from the belly button, if there is a foul smell, if your baby has a fever, a temperature of 38 degrees Celsius or 100.4 degrees Fahrenheit or higher, if your baby is fuzzy, or if your baby is crying whenever you touch the area. The umbilical cord has direct access to the bloodstream, so even if your baby has a mild infection, it can get serious quickly. The infection can enter the bloodstream, and this can lead to sepsis, which is a life-threatening infection that can damage your baby's organs and tissues. So call your doctor immediately if you note signs of umbilical cord infection. This is fatal in about 15% of babies, and this is considered a medical emergency. If your baby was born premature, your baby is even at an increased risk for severe infection. So what's treatment for an umbilical cord infection? Your doctor would determine the best form of treatment for your baby. Your doctor may take a swab on the infected part, and this is sent to the lab to be examined. Once the germ causing the infection is identified, your doctor would know the right antibiotic to treat it. Once the cause is identified, treatment would largely depend on the extent of the infection. Is it a minor infection? Is it moderate? Is it severe? For minor infections where there is a small amount of pus but your baby is fine, well, your doctor might prescribe an antibiotic ointment to be applied to your baby's skin around the cord a few times a day. Take note though, minor infections can become serious quickly if it is not treated. Now, how to treat a more serious umbilical cord infection and how to take care of your baby's umbilical cord at home? Well, before we go to that, do you have a newborn? Or you're expecting a baby? Well, how much better life can be when things are under your control upon your baby's arrival, where you feel confident about breastfeeding your baby, when you know how to soothe a crying, fuzzy baby, when you know when to worry and call the doctor, when you can understand your baby's sleep schedule and better take care of your baby and better take care of yourself as well. How much better life can be when you can get the training at the comfort of your own home. Well, I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. For a more serious umbilical cord infection, how is it treated? Well, your baby would likely need to be admitted at the hospital in order to obtain intravenous antibiotics to fight off the infection. Intravenous or IV antibiotics are delivered to your baby through a needle inserted in your baby's vein. your baby may need to be hospitalized for several days to receive the treatment. IV antibiotics are usually given for 7 to 10 days. In some cases, once the infection is bad, this might need to be surgically drained as well. So how long before your baby recovers? Once the serious umbilical cord infection is caught early, your baby would likely recover in a couple of weeks, but your baby may need to stay at the hospital to receive the intravenous antibiotics. If your baby needed surgery in order to drain the infection, the area might be packed with gauze, and once the draining has stopped, the gauze would be removed, and the wound would heal from the bottom up. Now, how to take care of your baby's umbilical cord. A few years ago, hospitals recommend covering the umbilical cord stump with an antiseptic to kill off germs. But nowadays, most hospitals and pediatricians recommend dry cord care. What is dry cord care? It is keeping the cord dry and exposing it to air to prevent any infection. According to research, dry cord care versus using an antiseptic is safe, easy, and effective way to prevent cord infection. How to go about dry cord care? Well, wash your hands and make sure they are clean before touching your baby's cord. Avoid getting the umbilical cord wet. If you need to give your baby a bath, just use sponge bath until the cord has completely dried and fallen off. At that time, you can already do a tub bath. Also, your baby's diaper, it is advisable to fold the front of your baby's diaper to keep the cord exposed to air. And if you note any poop or pee around the umbilical cord, then just clean it off and sponge it off with warm water and keep the area dry. What are other ways to prevent umbilical cord infection? Well, there's two: skin-to-skin contact and breastfeeding your baby. How to go about skin-to-skin? Well, with your bare chest and baby naked except just a diaper, put your baby on your chest and then cover. This exposes your baby to normal skin bacteria. Studies have shown that babies who had skin-to-skin contact with mom are 36% less likely to develop umbilical cord infection. And breastfeeding, well, you mom would pass antibodies which helps fight off infection to your baby. Hey, if you like this video, watch my next video where I teach you about other child health problems.